This is a very, very difficult topic, and so one of the questions you might think about as we're looking at this topic of human trafficking is, why would we or why should we be concerned about human trafficking in covenant health systems? And we can come back to that question when we toward the end. So what is trafficking? You know, 10 to 15 years ago, that term was relatively unknown. You know, we didn't think about human trafficking, and it's kind of like the term of domestic violence of 40 years ago. You know, domestic violence today is part of our vocabulary, but 40 years ago, that wasn't the case. And so now human trafficking is exploding into our consciousness today on all fronts. And it's a difficult topic to hear about, read about, find out about, and yet it's endemic throughout the whole world. So when we talk about trafficking, what is it? There are various kinds of trafficking. Like sexual trafficking involves manipulating victims into the sexual commercial industry. And labor trafficking involves coercing someone into various forms of labor. It could be domestic servitude, it could be farm labor, it could be withholding passports, taking away their legal documents, not paying them. They said for every one person that is sexually trafficked, there are 9 people who are not paid for their labor. It may be coercion, holding out false promises, using the relationship, depriving people of medical or dental care, lack of basic necessities, threatening other family members, physical abuse and so forth. I had an out-of-town visitor this past week, and so we brought them up to all the wonderful spots in New England, and one was up in Salem, and it talked about how the person who was a fairly wealthy landowner in Salem actually brought indentured servants from England, and the person would sign a document and be in labor in that household for 7 years and then became free. And the same thing happened in Australia when people went out as convicts for stealing a loaf of bread. There would be an indentured servant for 7, 10, 15 years. What is hard for us to fathom is that indentured servants are still in existence today in wealthy suburbs in some of our major cities in the United States, where people are unpaid forced labor and have their papers taken away from them. In our time, it's inconceivable, but it's still going on. It's not just from 300 years ago. So, all of the different kinds, and, the sweatshops, the rag industry, even down on Manhattan, until recently, people were living up on top of those floors, making clothes and so forth. And they were brought in from other countries. So it's a huge, huge, huge issue that we are beginning to think about and become aware of. So what are the types of exploitation? Prostitution and exploitation, and it's from children up through adulthood, forced labor, slavery, and it's not just women, it's also men. I remember reading in the National Geographic a few years ago about those wonderful skyscrapers that we have in Dubai right now, the fabulous architecture. They were advertising for men to come from different parts of the world, which they did, and then their passports were taken away from them, and they were bussed into these sites every day, and they were paid a minimum of basically about $2 a week and lived in squalid conditions. So they were never going to be earning enough to send back to their families or get out of that situation. And yet we have the tourism, flocking there to enjoy these marvelous buildings. The notion of peonage or debt bondage, where this situation I just described, where a person would come and they would have to work for 7 years, 10 years before they could get their freedom. And so also they say that over 800,000 people are trafficked. And here again, the numbers are inconsistent because it's such a below the surface kind of activity, but that these people are brought into the United States every year. And then because they're illegal, they can be threatened with exportation or reporting to the authorities if they complain. That happened also very much with the migrant workers working in the farm fields, that they would work all summer long, and then at the end of the summer would not be paid and would be turned over to the authorities. I mean, the grave injustice that was done to these people. Just in the paper last week, there was an incident of, where some women enter the massage industry, legitimately, but then they're forced into slavery. And there was one woman, she hadn't been outside or seen the sky for several months. I mean, for us, that is inconceivable. It's difficult to get some of the numbers. But the U.S. Department of Justice indicates that in the United States, the profits from trafficking are about $20 billion a year. And it's quickly outstripping illegal arms and drug trafficking as the #1 crime here in the United States. That kind of blows your mind because we have more of a familiarity with the drug trafficking that goes on. And when you think of human trafficking as being greater than that. And sad to say, 80% are women and girls and young children. The U.S. Department of TIP stands for Trafficking in Persons, in 1911, provides information on trafficking in 188 countries around the world. Now, I don't know the exact number of countries in the world. It's about 200. And when you think that this, and it's frightening when you read the State Department, I picked it up last summer and read it, and it gives reports on what's happening in 188 countries around the globe. In China, they have, last year, they had 7,000 gangs, but there were only 168 arrests for trafficking. And children as young as 19 days are being trafficked. Perhaps some of you saw the Boston Globe this past Sunday. Many of you saw this Globe article this past Sunday. It's very poignant. These two detectives saw a photograph of a little bunny, and the man who sent this bunny thought he was sending it to another person in the porn industry. He was actually sending it to 2 underground detectives. The man was from Worcester. Was a father of a family, had 3 children, was the manager of a Sheraton, very respectable in the community. But they found 27,000 images on his computer of children. And when these 2 detectives searched through, they found that a whole web, an international web from the United States to Mexico to Europe and several different countries. And they found that the youngest infant who had been sexually abused and trafficked was 19 days old. It's so if you were to read this, it's pretty horrific. So these men, 2 detectives, work in Boston, and what they're finding out is that when the detectives are doing this kind of work, it's so intense that they suffer potential PTSD themselves. And so their superintendent has told them they're free to leave at any time with no sense of shame because, as they say, they're fathers of families themselves. So I'll leave this, pass this article around, but it's frightening in terms of how pervasive this is and how the respectable people in our society can be involved in this. It's underneath our noses. This comes from Unanima. It's it's a group down at an NGO down in the United Nations where 17 religious orders have gotten together to work against human trafficking around the world. My own community is a member of this. But it says that the United States is both a source of trafficking, it's a transit exporting people for trafficking, and it's also a destination country in terms of bringing people into the United States. I don't have but you can see where they're coming from all over the world into the United States. So these are the United States routes for human trafficking. Then if you look at South America, where the Brazil, the Philippines, or Somalia, Haiti, they're all sources of people being brought in for trafficking. And those are the South American routes. And they're given false passports, will be brought in, or if they come. And then another issue is, remember a few years ago with Russia, with the women brides being brought over here to the United States. So it's pandemic in many different forms of society. These are the Southeast Asian routes. It said the sex industries of Indonesia, Malaysia, Thailand, and the Philippines make up from 2 to 14% of the gross national income of those countries. So you think about it, it's heavily supported, well organized. In Japan, the sex industry makes approximately $83 billion a year. And there are over 150 people 50,000 people in the sex industry in Japan. In Germany, there are 400,000 prostitutes and they serve 1.2 million men a day. And the annual turnover is 18 billion. You know, so it's frightening. And so sex tourism is the reverse of sex trafficking. You know, we think of Thailand as one of the countries for sex tourism. Here in the United States, Atlanta is one of the cities for sex tourism. And so, you know, the World Soccer Games, at the Super Bowl, Craigslist, right now the Olympics in London, there was an article the other day about a concern about the domestic workers not being paid adequate wages around the Olympics. You know, the concierge services, you know, truck stops are a big place for, and the nail salons, you know, just be on the watch out if you're going to get your nails done. The hospitality industry is well positioned in terms of human trafficking. And so Marilyn Carlson Nelson was the chair of the company that owns all the Radisson hotels, the Country Inns and Suites, and so she's been a pioneer. And she's one of the first people to sign a code of conduct, which is a commitment to protect children from human trafficking. There was a hotel recently, and this person noticed that there were trays of ice cream going up to a room. And upon investigation, that room was full of underage children, ready to be available for services, and they were giving them ice cream to keep them quiet, you know, which is scary. So actually Nancy has been working with some of our folk, and we're in the process of developing a contract that will abide by the rules in terms of if we have meetings in hotels, that they will ensure that they're not going to be offering concierge services and so forth. So the signers to this code of conduct agreed to educate their customers, include a clause in the contract with suppliers regarding exploitation, establishing a clear company policy, and train their staff to be skilled in identifying potential red flags and knowing how to respond. You know, there's also a Polaris group who are willing to develop shelters. Do you know that there are more animal shelters in the United States than there are domestic violence shelters? And then the human trafficking shelters are even fewer. The sisters in the Northeast region, the LCWR, they have established one house and are establishing a second house in the Boston area to help take care of people who have been trafficked. And so they're willing to try and do that. So the issue of women and girls being exploited on the basis of race, nationality, caste or color are especially vulnerable to sexual exploitation. If you remember, in the Gulf War, many of the women in Saudi Arabia were raped. And the sad thing was they were doubly victimized because then they could not be brought back. Their families refused to accept them back into their families. You know, and so the whole oppression of women, we know it, like the whole issue of honor killings in families if a woman is dating somebody not of our own race or community. So in 2003, the Palermo protocol prioritized the issue of trafficking women and children as one of their goals. They began to criminalize trafficking, and we'll come back to that in a moment or two, provides assistance and protection to victims, seeks to prevent trafficking through international cooperation and information sharing. And this past year, all the Attorney Generals of the United States have made to work against human trafficking a top priority. In 2007, the United States Senate designated January 11th as the Day of Vigilance and Awareness about human trafficking here in the United States. You know, demand is global and demand is local. It's, you know, there's international sex trafficking and violation of fundamental human rights, but it's local in that it's happening everywhere, in our towns and our villages. Lowell is one of the main cities for human trafficking here in Massachusetts. A few years ago, back in 2005, the former chair of the town council of Kittery, Maine, and a lawyer, he was convicted for trafficking and having children as young as 13 in his prostitute parlors. 13 years, he was a respectable member of the community. There was a man convicted in Rhode Island. He had 5 women enslaved in his house as sex trades. So it's all over. So Sweden has an interesting approach. They said it's time to flush the Johns out of the Baltic. So in Sweden, it's a crime to buy sex. And if you look at the location of Sweden, it was just right on the borders of Eastern Europe. So it had become a major destination point for the trafficking of bringing in women from Eastern Europe. And so now they've made it a crime both to buy and sell sex. The Netherlands, the Deputy Prime Minister, she thought about it in terms of gender equality. And she said that we cannot have gender equality as long as there's a subclass of women and children. And so she has really been an advocate for it in terms of those who are economically and racially marginalized from the universal protection of human dignity. Now that's a little bit different. So Sweden has taken a multi-pronged approach. Now it's interesting, in the Netherlands, for example, they have criminalized enforced trafficking, but they have legalized prostitution in the Netherlands. And so in Amsterdam, there are 8,000 to 11,000 prostitutes that have been victimized by gangs and belong to gangs. So, that's a different situation than the Sweden. But in actual fact, it's much closer to home. There's an organization called NICAT, the New England Coalition Against Trafficking, and it's coordinated anti-trafficking efforts throughout here in the Northeast. Now, in Maine, the Catholic Charities in Maine, the Maine Coalition Against Sexual Assault, and there's another program, Mano and Mano, hand in hand, in Maine, have worked on against human trafficking. But there's no law yet in Maine. I was looking it up, and back in 2006, Maine had begun to put together a law, but it has not yet been passed. In New Hampshire, they passed a law in 2007. But back in 2003, New Hampshire prosecuted a man and a woman because they had 4 men from Jamaica working for them. They weren't paying them. They had no medical benefits, rights, and they also had taken away their passports and legal papers, so they couldn't escape. And so they were prosecuted back in New Hampshire back in 2003. But the Lutheran Community of Services of New Hampshire and the New Hampshire Coalition Against Domestic Violence are working together in NICAT in Maine. In Massachusetts, we have the Lowell Community Health Center with the Lutheran Social Services of New England. And it was only last November in 2011 that Massachusetts has passed a law against trafficking, and they've already prosecuted 1 or 2 people in that. The case I mentioned in New Hampshire was only the second case in the country in 2003 where somebody was prosecuted for human trafficking. In Rhode Island, there's a Rhode Island Coalition Against Trafficking, and they have had a law passed since 2009. So Maine is one of 10 states that has not yet passed a law against human trafficking, which makes it criminal behavior. In 2009, there were 5,500 trafficking prosecutions reported worldwide, and there were 4,000 convictions worldwide. That's a drop in the bucket. In 2009, there were 49,000 trafficking victims identified worldwide. The prevalence of trafficking is 2 people per 1,000 inhabitants, but the trafficking victims in Asia and the Pacific are 3 per 1,000. And as I mentioned, for every 1 sexually trafficked person, there were 9 who were forced to work without wages. UNICEF says that there are over 1.2 million people trafficked every year. 2/3 of the women were women, and 13% were girls, children under 18. And I said the youngest was 19 days. So it said, what are the traits of the human traffickers? Well, there are many different personalities, countries, whatever, but it said that they share certain traits. They're tremendously self-confident, tremendously manipulative, You know, they charm the girls into this, and they have an utter disregard for the humanity of other people. Basically, that would line up to be the portrait of a sociopath. They figure out how to make money out of cruelty. In many instances, if a woman does not make her daily quota, and in prostitution, the average is $500 to $1,000 per day. They may be beaten. In one instance, this woman, Madame, branded them with an iron, or they may be left without food. Many of them suffer from malnutrition. We had a person from Harvard speak to our vice presidents last fall, and she says if a woman gets out of being trafficked, she goes on the streets, and her average lifespan is less than 7 years after that, you know? And so that's a kind of a scary thought. In the new Massachusetts law, which was the 21st of November, just prior to Thanksgiving last year, they now may be punished by a mandatory minimum sentence of 5 years, a potential maximum of 20 years, and a fine of up to $25,000. And businesses can be fined up to $1 million. And if a person being trafficked is under 18, the sentence may increase to life in prison, and also includes stricter penalties for people who seek out prostitutes. Governor Patrick, when he was signing this bill, he said, "It is a devastating problem. It's a problem that disrupts families, turns lives upside down, affects communities, and has ripple effects throughout a whole host of corners of our Commonwealth and our character as a community." So what is the impact of that law on victims? It says now victims of trafficking, underage children and women will not be treated as criminals and put in handcuffs, which had happened prior to this time. They will be treated as victims of rape. And so now they're entitled to the care that applies to a rape victim. If an adult is being trafficked, they can only be reported to authorities if the adult consents. And there's a little difficulty with that. You know, we've heard of the Stockholm Syndrome, where people identify with the aggressor. And so very often these people may identify with their pimp or John or whomever and are scared to leave that situation. There's a situation called learned helplessness. You know, that Skinnerian thing of where they zap dogs and they're in a cage. And so eventually when the door is open and they're not zapped, there's that memory of being zapped is so much they're scared to leave the cage. And so in a sense that would apply to victims who have been trafficked. So the potential for freedom may be there, but they're so scared and so brainwashed that they may be afraid to take the opportunity for their own freedom. And now if a person is under 18, that indeed can be reported. Also, certain benefits such as immigration relief and social services may be available to victims. There's another piece called a T visa, a trafficking visa, that if a person who has been trafficked is willing to give some information about the perpetrator, they may be given a visa and being able to stay in this country, at least for a certain amount of time. There was an instance recently where a case came to light where a young girl from China, she was 14, when she was sold by her father into trafficking, and she was sent here to the United States, was trafficked, but somehow became free and actually went and got her GED and got married in this country. But she was illegal, and so she was going to be deported back to China. And she knew that if she were deported back to China, she would be killed by her own father, you know? So there's that catch-22 for victims. It's really scary. And then there are cultural threats to folks too. You know, in one situation it was reported that the trafficker said to the victim, "We're going to take your soul and keep it in this place until you do what you're told to do. Until you do that, we're not going to give you your soul back." Now, to us that may seem kind of odd, but in many cultures, that notion of the soul is the most precious thing a person possesses. And the notion of somebody else robbing their soul is incredible. There was a book which is not in the area of human trafficking, but it was written by Anna Fadiman, and it's called "When the Spirit Catches You, You Fall Down." And it's about the Hmong people who came. The highest population of the Hmong population is in Los Angeles. And there was a young couple, physician couple, who were taking care of their infant who had epilepsy. But the cultural differences were so huge that the child ended up becoming a vegetable. But it was that notion of the soul of the child and the differences of the medical approach and the cultural approach. So you can imagine that by virtue of being terrified that their soul is going to be taken, and if they're told that violence has already been done to the person in terms of their mind, body, and spirit, you know. So what are we going to do about this? Well, one of the aspects of that is there's a growing consensus that if we can address the demand, it's a key to the prevention of trafficking. You know, so, but how do we prevent the demand? Is by, I think, increasing the legislation and consequences of the demand. The US Department has developed a four-prong approach in terms of prevention, protection, prosecution, and partnership. In terms of prevention, they're saying, let's try and reduce the demand by having consequences for those who demand it. In terms of protection, they have a three-pronged approach in terms of trying to rescue the person. But here again, they're finding it difficult because of what I said, that the victim can have an identification with the perpetrator and be scared to leave. There's a whole process under protection of rehabilitation. And you can imagine the sense of intense shame that a person would experience and self-blame. You know, that's one of the issues of power in any kind of abuse, that the person blames himself or herself rather than blaming the perpetrator. And then how to, the one third aspect is to reintegrate the person into society, and that's very, very difficult. The New York Times back in just July, just 2 weeks ago, had an issue, a story about Taz. T-A-Z. And Taz was 16 years old, a girl in New York City, and she said that her pimp had branded 3 girls with tattoos bearing his name. They were his property. And she refused the tattoo, and when she refused the tattoo, he held her down and branded her on her back with a safety pin with his name. You know? And so then she said she tried to escape. And she says, I got drowned. The pimp choked me, put me in the tub, and when I woke up, I was drowning. He told me he'd kill me if I left. Another time she tried to call 911. She said he hit me over the head with a broken bottle, and then he ordered the other girls to sweep up the broken glass. So you can imagine the reign of terror. So when the police found Taz, they found an angrily defiant prostitute, but over time she began to tell her story. And so this interviewer asked her, what would she like to be when she grows up? She's only 16, and she smiled a little self-consciously, and she said, I would like to be a pediatrician. You know? So underneath that defiant surface was a very hurt young woman who still had dreams about her life if she could be freed. And so then how do we enter into partnerships across society to begin to detect the signs of this, to become aware ourselves and to do something about it? So what about the Johns? Or pimps who, you know, so since 1996, there have been over 30 education programs around the country. It started in California. And so the Johns are, when they're caught, have to go into this re-education program. And it says their initial reactions are denial. You know, we all know about denial. You have to say it's not a river, you know, that we practice it at some stage in our life. There's a justification of their behavior. And then they project the blame onto the police or the legal system. You know, so that's, but then after they go through this education program, they begin to see the light that they can be charged with a very serious crime. And now that the states are putting in consequences, it does have consequences. They may have serious health issues for their life, and they're also leading double lives. And so since 1995, 6,000 men have participated in the California program. So why should we care? So that was the question I asked you at the beginning. You know, why should we be concerned about this in Covenant Health Systems? Our mission is healthcare. And if all of us have in our mission statements, care of the vulnerable and the creation of healthy communities, you know, and surely these people are vulnerable and need to be part of a healthy community, not the terrifying community to which they belong. Also, it may impact the lives of our patients, our employees, their families. You know, and many of us have people employed who are from other countries. It may impact their lives, you know. So, you know, I remember some years ago when on this issue of suffering in society, and that one of the tasks, and particularly in human resources, is how are we connected with the range of hidden pain in people's lives? You know, that every person comes with a story, and of heartbreak, joy, sadness, laughter, whatever, and sometimes we don't know the story. And it would take a relationship of trust to develop before we actually hear the story. But there may be stories of people, you know, in our communities who, you know, in our healthcare communities who need our care. It's also a crime against humanity. You know, one of our basic core values in Catholic healthcare is respect for the dignity of the human person. And this is such a disregard for the dignity of the human person. And so that is what Bishop Dolan says, that it's core teaching of our faith, the value and dignity of each human person. No one deserves the degradation of being trafficked in any manner, shape, or form. So what can we do? We can become aware, you know, even though we mightn't want to. I had a hard time reading that article from the Sunday Globe. As soon as I saw the topic, I wanted to not read it, but I made myself sit down and read it. You know, so it's tough reading this stuff. Last August, we had a discussion here at the corporate office among the vice presidents. We had Kathleen McLaughlin come from Harvard, and she made a presentation to our senior management group. Nancy's been working on our vendor contracts with Yankee, and you would feel proud of them because many of us do business with Yankee Alliance, that now they're putting into their vendor contracts about you know, labor laws, with which you are all familiar, and that we will in no way do any business with anyone who you know, employs children underage, is involved in human trafficking. St. Mary's Lewiston last September had a program. They worked with other organizations in Maine in a program called Not Here, in terms of mobilizing communities against injustice and oppression, and they will also be having another 2-day workshop this fall against human trafficking and St. Mary's, and also some folks up in Bangor, Maine will also be involved in that. And we made a presentation to our Covenant Board of Directors last December, and they really took it aboard such that on the action plan for Covenant this year, it says each Covenant facility will offer an education awareness session on human trafficking. So that's what we're beginning today here, and so we'd be happy to go out and talk with you and hope to make a presentation to all the boards. Also, Ann Berger and MC will be working with our emergency room personnel on training people to identify victims of human trafficking. If a person shows up in the emergency department, and sometimes, if a person shows up who's been trafficked, the perpetrator might want to stay in the room with them, so there's no freedom. It's become commonplace now in terms of domestic violence. How many of you have gone into your physician or primary care or emergency room, and one of the intake questions will be, do you feel safe at home? How many of you in this room have had that question asked of you? Now it's interesting how people ask that question. It's such a perfunctory. Do you feel safe at home? So, it's kind of like the advanced directive question. Do you have your advanced directive, and check it off? Others ask it in a very meaningful way. Do you feel safe at home? And how would that be responded to? But that's only since we've become aware of domestic violence. So maybe perhaps as we go forward, we can do more on this also in terms of trafficking. Okay, so David is going to pass this out. It's a little 2-page in terms of the trafficking issues in different countries and what do we do to stop the demand for human trafficking, and why does the demand. So it's kind of a little fact sheet on human trafficking that may be useful to you. This little video is a 23-minute video. It's called The Fields of Mudan. It's made by a university in Florida, but it's very poignant. it talks, Mudan is a little 9-year-old child, and you show her playing the fields of Vietnam, playing with her mother, and she gets trafficked. And she's 9, there's an 11-year-old, maybe a 13-year-old, and the madame, and how they're grooming her to be trafficked, and the traumatic. And she draws a little picture of herself and her mother, and the little 11-year-old befriends her, so she draws the little 11-year-old on the picture also. But then the other 2 girls try and prepare her for what's going to happen to her. But she doesn't have so it's just awful. But anyway, we do have that video. It's only $9. You can find it on whatever. But it's, you know, so it's a huge issue, and it's a disturbing issue, and it's a distressing issue. And, you know, we just have to be alert and be aware and do whatever we can. The religious communities that have formed this NGO are working on human trafficking all over the world, and these 17 religious communities have ministries in 77 countries. Like, I was talking to one of our own sisters last week, and she had spent time in the Philippines working on this issue. So if we all unite together, we can do something about this, you know? And I think it's admirable that Covenant Health Systems, I mean, that's 6,000 people. If we help 6,000 people become awake about this, that's huge. You know, individually it's difficult to do, you know, but together we can do a lot about this and make a difference. And, you know, one person can do some, but if we create a whole conscious and make this in terms of our vendor relationships, in terms of hotels we work with, and you're in a unique position in human resources to do consciousness raising and also be sensitive maybe to employees and whatever in terms of how that might impact their lives.